In this video, I'm going to show you how to use eye drops properly. Many of us use eye drops at least from time to time because of dry eyes, infection, or even glaucoma. However, many of us don't exactly know how to use eye drops properly. If eye drops land on your eyelids instead of your eyes, you will waste your eye drop. This might become a problem if you're using glaucoma medications, which can get pretty expensive. So for today's video, I will walk you through the proper steps in using eye drops, helping you to save some time, improve your eye drops efficiency, and hopefully save you some money. Let's dive right in. Hi everyone, welcome to today's video. This channel dedicates to providing you with the most informative and up-to-date eye care information so you can take better care of your eyes and vision. If you are new here, consider subscribing to this channel so you won't miss any of my future videos. If you have suggestions for me, feel free to leave them in the comment section below so that I know how to make my videos even better. Has anyone ever taught you how to use an eye drop? In fact, no one taught me in the past and I just recently found out that I've been doing it wrong for 10 years. Using an eye drop will vary depending on the medication, but generally, here are the steps. Step 1 is to wash your hand before touching the dropper bottle because you will be handling your eyes and the last thing you would like to do is to give yourself an infection. Step 2. Check the expiration date written on the bottle. Generally, eye drops with preservatives expire 1 to 2 years after the date of manufacturing. Once they are opened, however, you should discard them 1 month after opening unless specifically notified in the manual, even if it's before expiration. For eye drops without preservatives that usually come in single-use vials, they should be thrown out 24 hours after opening. Another helpful tip is to make sure that the bottle you are holding is actually an eye drop and not an ear drop. Eye drops are usually not a problem for the ear, but ear drops should never be used in the eyes. If you get ear drops into your eyes, flush your eyes with saline solution and seek medical attention if the improvement is not immediate. Step 3. Shake the bottle for around 5 to 10 seconds. Doing so will mix the ingredients and improve the medication's effectiveness, which is especially important if you are using a suspension eye drop. Step 4. To avoid contamination of the eye bottle, remove the cap and place it on a paper towel. You are also advised to observe the tip of the dropper bottle and look for signs of colorization, which is a sign of contamination. If the eye drop is contaminated, don't use it. Step 5. Start by tilting your head backward while sitting, standing, or lying down, with your index finger placed on the soft stalk below the lower eyelid. Gently pull down to form a pocket. The pocket increases the target size for the eye drops to get into the eye. Step 6. Hold the bottle over your eye. The dropper tip should be as close to your eye as possible without touching your eye to avoid contamination. You can support the hand that's holding the bottle by resting your wrist against the other hand. Don't free flow your hand around the air because you can easily miss the target. Step 7. Squeeze the bottle so that a single drop falls into the pouch you made with the lower eyelid. Close your eyes for 3 minutes without blinking. Keeping your eyelid closed can keep the medication to your eyes. If you keep blinking, the medicines will be flushed through the drainage canal of your eyes down to the nasal cavity. The pro tip here is that you can perform punctal occlusion, where you press your fingertip against the inner corner of your eye. Doing so will compress the tear duct and prevent the medicine from entering the drainage pathway into your nose. This is especially important if you are using glaucoma medications. When eye drops get into the nasal cavity and come in contact with the nasal mucosa, the drug can be quickly absorbed and enter the bloodstream. If glaucoma medications such as beta blockers and alpha agonists get into the bloodstream, they can lead to breathing problems, pounding hearts, and many other nasty side effects. After that, you can use a tissue or other cloth to wipe away any excess liquid from around your eyes and recap the eye drop bottle. Oh, I forgot to mention that you should only use a single drop at a time. Do not apply multiple drops. Normally, a conjunctival sac has a capacity of 20 microliters, and tears usually take up 7 to 9 microliters of space. So in many cases, your eye can only absorb 10 microliters of medication at a time. Current eye drop bottles dispense 30 microliters of medications for each drop, which is far more than your conjunctival sac can contain. If you apply multiple drops, the excess medications will not be absorbed. Rather, they will enter the lacrimal canals, get taken up by the mucous membrane in the nasal cavity, and enter your bloodstream, leading to all sorts of systemic side effects. In addition, you don't want to waste your eye drops, right? This is especially true if you are using glaucoma medications or other dry eye medications such as Xiidra and Restasis, which cost like $600 for a month's supply. So yeah, applying multiple drops at a time does little benefit other than producing waste and exacerbating side effects. Before I end this video, let me share a few more tips about using eye drops because they can be helpful. Number 1, you should never use expired eye drops. The expiration date indicates when the eye drops are no longer guaranteed to be effective or sterile. As time goes by, the active ingredient inside the eye drops will degrade and potentially change into harmful compounds. After the bottle is opened, exposure to oxygen can accelerate the degradation of chemical ingredients. If you use expired eye drops, the broken down chemicals can irritate your eye and lead to redness. Also, many eye drops contain preservatives to help them stave off germ contamination. But once the eye drop is opened, preservatives will weaken over time, and germs can get into the bottle and cause infections. So please, your eyes are essential. Never use expired eye drops. Second, if you wear contact lenses, it's best to remove your contacts before putting the eye drop in unless you are specifically instructed by an eye care professional. Preservative-free rewetting drops are generally okay with contact lenses. Otherwise, check with a doctor because preservatives in other drops can be absorbed into the contact lens and damage the lens. Lastly, if you have trouble figuring out if you actually got the eye drop into your eye, consider refrigerating them so that you can feel the cooling sensation inside your eye. In fact, eye drops should be kept away from sunlight and be stored at a temperature below 25 degrees Celsius. Eye care professionals sometimes recommend refrigerating eye drops to avoid degradation. Of course, feel free to double check with a doctor if the eye drop can be kept in a refrigerator. Also, if you need to take more than one type of eye drop at the same time, wait 3 to 5 minutes between the different kinds of medication. Applying an eye drop immediately after another will only allow your medications to interfere with one another. Alright everyone, thank you so much for watching. If you liked the video, please hit the subscribe button below and give me a thumb up. You can find my other videos on this channel if you want to learn more about the eye, and I would love to have you in this community. Take care of yourself and be well.